Of all the rooms in your house, there's one room that's quietly been giving you a daily health report for years, and almost nobody reads it. The bathroom, specifically the toilet bowl, and the simple, almost automatic habits surrounding it that most of us have stopped paying any real attention to since childhood. Here's why this matters so much for your kidneys specifically. Your kidney's entire job, all day, every day, is filtering your blood and producing urine as the output of that filtering process. Which means urine isn't just waste. It's essentially a direct readout of how well that filtering system is working, sitting right there in the bowl, every single time, completely free to observe, requiring no appointment and no blood draw. In this video, we're going through 5 specific bathroom habits and changes. Some about the urine itself, some about timing and frequency. One most people have genuinely never connected to kidney health at all, that, especially in combination, can be among the earliest signals that kidney function is starting to decline, often well before it would show up as a major symptom anywhere else in the body. I want to set the tone clearly before we start. We are talking about early signals of declining kidney function, which is a gradual process that, when caught early, can very often be slowed or managed effectively. We are not talking about a single symptom, meaning your kidneys have failed. That distinction matters, and I'll come back to it throughout this video. Let's start with why your kidneys are so good at hiding trouble in the first place, and why these bathroom signs end up mattering as much as they do. We touched on this in a previous video, but it's worth repeating here because it's the entire reason this topic deserves its own video. Your kidneys have enormous reserve capacity. You can lose a significant percentage of total kidney function and still feel completely normal in day-to-day life, with no pain, no obvious symptom, nothing that would prompt you to see a doctor on its own. This is precisely why subtle external clues, like the ones we're about to cover, carry more weight than people realize. They're often available well before fatigue, swelling, or other more commonly discussed symptoms appear, simply because they reflect the filtering process directly, rather than reflecting a downstream effect that takes longer to build up to a noticeable level elsewhere in the body. Number 1. Urine that appears unusually foamy or bubbly, particularly if this is a new and consistent pattern rather than an occasional one-off. A small amount of foam, especially from a fast stream hitting the water, is completely normal and not a concern on its own. What's worth paying attention to is foam that's persistent, noticeably more than usual, and doesn't go away after the toilet has been flushed and refilled. This particular pattern can indicate protein in the urine, a condition called proteinuria, since protein in liquid creates a more stable, longer-lasting foam compared to the brief, normal bubbling caused simply by water movement. Here's why protein in urine matters specifically for kidney health. Healthy kidneys are very good at retaining protein in the bloodstream, where it belongs, while filtering out genuine waste products into urine. When the tiny filtering units in the kidneys become damaged, they can start allowing protein to leak through into the urine, which it normally wouldn't do. This makes persistent foamy urine one of the more specific, useful early clues on this entire list, because it points fairly directly at the filtering mechanism itself rather than at something more general. What to ask your doctor? A simple urine test, sometimes called a urinalysis, or a more specific test for a protein called albumin, can check for this directly and is quick, inexpensive, and widely available. Well worth requesting if you've noticed this pattern persisting. Number 2. Changes in urine color that aren't explained by simple hydration, or, as we discussed in a previous video, by something harmless like beets. Normal healthy urine ranges from pale straw to a deeper amber yellow, depending mostly on hydration level. Pale when well hydrated, darker when more concentrated. A few specific color changes are worth knowing about beyond that normal range. Urine that appears notably dark, like tea or cola, particularly when it's not explained by dehydration, can indicate a buildup of waste products the kidneys aren't filtering out as efficiently as they should. Urine that appears pink or reddish, when not explained by beets, certain other foods, or a known harmless cause, can indicate blood in the urine, a condition called hematuria, which always deserves medical attention, regardless of the underlying cause, since the possible explanations range from a urinary tract infection to kidney stones to, less commonly, kidney disease itself. And the only way to know which one applies is through proper testing. And cloudy or murky urine, especially paired with an unpleasant odor, can indicate either an infection or, in some cases, the presence of excess protein or other particles related to reduced kidney filtering function. The genuinely useful habit here is simple. Actually look, just for a second or two, before flushing, rather than flushing automatically without ever glancing down. It costs nothing and takes no extra time, and it's the single easiest habit on this entire list to start today. Number 3. And this one cuts in two opposite directions, both worth knowing about. A meaningful change in how often you're urinating, whether that's a noticeable increase or a noticeable decrease from your own normal pattern. An increase, particularly urination that increases significantly at night, a pattern called nocturia, can have several causes, including simply an enlarged prostate in men or an overactive bladder, both very common and not necessarily related to kidney function at all. But it can also occur because, as kidney filtering efficiency declines, the kidneys can lose some of their normal ability to concentrate urine properly overnight, the way a healthy kidney does, resulting in more frequent urination, specifically during sleeping hours. A decrease in how often you're urinating, or producing noticeably less urine overall, despite drinking a normal amount of fluid, can be an even more specific signal, since it suggests the kidneys may be filtering and producing urine less effectively than they should, rather than simply a bladder-related issue. A meaningful decrease in urine output, especially if it develops over a relatively short period, generally deserves more prompt attention than most of the other signs on this list. What matters most here is the change relative to your own personal normal pattern, rather than comparing yourself to some general standard, since normal urination frequency varies quite a bit between individuals based on fluid intake, age, and several other factors. Number 4. New difficulty, straining, or discomfort during urination. I want to be straightforward here. This particular sign, on its own, is actually more commonly related to other causes than to kidney function directly, including urinary tract infections, an enlarged prostate in men, or bladder-related issues, and these other causes are genuinely the more likely explanation for this specific symptom in isolation. The reason it's still worth including on this list is the connection that runs in the other direction. A urinary tract infection or any other condition that causes urine to back up or causes a partial blockage of normal urine flow, if left unaddressed for a meaningful period of time, can itself begin to put strain on the kidneys, since the kidneys rely on a properly functioning, unobstructed system downstream from them to do their job effectively. This is exactly why a urinary tract infection, something many people consider a minor, almost routine inconvenience, particularly in older adults, genuinely deserves prompt treatment rather than being left to resolve fully on its own, since a more severe or poorly treated infection has a real, if often overlooked, path toward affecting kidney health if it travels upward toward the kidneys themselves. A more serious condition called pyelonephritis. What to ask your doctor. Any new pain, burning, or difficulty during urination is worth addressing promptly rather than waiting it out, both for its own sake and because of this indirect kidney connection. Number 5. And this is the one I mentioned at the very beginning that genuinely surprises most people. Persistent, unexplained itching, particularly noticed most while in the bathroom, during or after a shower or bath. Here's the connection, and it's a genuinely interesting one. As kidney filtering efficiency declines, certain waste products that would normally be filtered out and excreted in urine can begin to build up in the bloodstream instead. One specific marker associated with this buildup is called urea, and elevated urea levels have a documented association with persistent, often difficult to pinpoint itching, sometimes called uremic pruritus in more advanced cases, though milder, less specific itching can occur earlier in the process as well. What makes this particularly easy to miss is that it's frequently misattributed entirely to something else: dry skin from aging, a reaction to a particular soap or shower product, a change in laundry detergent, dry winter air, or simple seasonal skin changes. And to be clear, all of those genuinely are far more common explanations for itching than kidney-related causes, which is exactly why this sign deserves a fairly high bar before it raises real suspicion. Specifically, itching that's persistent over weeks rather than days, doesn't respond to switching soaps or moisturizing more diligently, and ideally appears alongside one or more of the other 4 signs we've already discussed today. What to ask your doctor. If you have persistent, unexplained itching that hasn't responded to the usual skincare adjustments, mention it specifically. And if it's accompanied by any other sign from this list, mention that combination clearly, since, taken together, it paints a considerably more specific picture than any single sign on its own. I want to bring all 5 of these back together now, because the actual usefulness of this video isn't any single sign in isolation. Every one of them, individually, has other common, often harmless explanations, and I've tried to be honest about that throughout. The real value is in noticing when 2 or more of these show up together, persisting over weeks rather than days, particularly foamy urine, alongside a meaningful change in frequency, alongside unexplained itching that isn't resolving with the usual remedies. That kind of combination, sustained over several weeks, is a genuinely reasonable, well-justified reason to ask your doctor specifically for kidney function testing, which, fortunately, is simple, inexpensive, and routine. It typically involves a blood test checking creatinine and calculating something called eGFR, which estimates your overall filtering capacity, alongside a simple urine test checking for protein and other markers. Both tests are quick, widely available, and many people have actually had them before as part of routine blood work without ever realizing what they were specifically checking. While this information is useful for everyone, certain groups genuinely warrant closer attention to these signs and more frequent kidney function testing in general. People with diabetes, since elevated blood sugar over time is one of the leading causes of kidney damage worldwide. People with high blood pressure, for similar reasons related to the strain placed on the kidney's delicate filtering vessels over time. People with a family history of kidney disease. And people regularly taking any of the medications we discussed in our previous video on this topic, particularly long-term NSAID use. If any of these apply to you, an annual kidney function check, even without any specific symptoms at all, is a genuinely reasonable, low-cost habit to maintain, simply given the elevated baseline risk. Your kidneys produce urine roughly the same way, day after day, year after year, almost entirely without your conscious attention, which is exactly why a few small, deliberate seconds of actually noticing, a glance before flushing, a thought about whether tonight's bathroom trips felt different than usual, an itch that just won't quit, can genuinely be some of the earliest, cheapest information your body offers you about one of its most important, hardest working organs. If this video gave you a reason to actually look before you flush, that's already a meaningful step. If you found it helpful, give it a like and subscribe for more clear, honest senior health guidance every week. And if you've ever noticed one of these signs yourself, let me know in the comments. Your experience might be exactly what helps someone else watching make the same connection in time. I'll see you in the next video.